Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the shoulder. It's a classic one, Speed's test. So this test was first described in a paper in 1966 by two physicians when they were talking about diagnosing bicipital tenosynovitis by Dr. Albert Crenshaw and Dr. William Kilgore. And they credit this test to Dr. Spencer Speed. That's probably why you're wondering, hey, you got those two guys, why is it called Speed? They were crediting it to another physician who actually worked at Campbell's Clinic over in Memphis, so very near where I'm from. So that was very surprising when I found this out. But anyway, they said that Dr. Speed notices when he was performing a straight leg raise that he would get a pain in that bicep tendon area, and he just said, yeah, there's probably something going on, and never really went much further than that. But it's a test that we have used for diagnosing, again, bicipital issues or slap lesions. So let's get in on how to do it. To perform this test, what you're going to do, you can have the person sitting or standing. Mateo said he's going to stand right here, and he'll be perfectly fine. You have the person raise their arm straight up in front of them, up to 90 degrees, with their arm supinated, so out like that. Then what you do, you apply a downward pressure onto the arm. And a positive is a production of pain in that bicep tendon area. Now, it's also been described that you can do an active flexion as well in that same position, and if that's pain, it could be it as well. That's what they said it was like with Dr. Speed way back when they came about it. So that is how you do Speed's test. So getting into the research on it, there is some variability in it. It's kind of all over the place. Now, one article, they looked at trying to improve the diagnostic abilities of diagnosing slap lesions, and they said if you use clusters of tests, that could be a little bit better. And so in like looking at the big grouping of this, they found very wide variabilities in like the sensitivity and specificity. So I think they were saying like the sensitivity was anywhere from like 19 to 90%, and the specificity was anywhere from 14 to 87. So very, very wide ranges on it. Now, another one did find that when it comes to looking at like bicep tears, so tears in the bicep, that they found that the sensitivity was about 50% and the specificity is 67% on that. So anyway, it's just kind of, again, all over the place, very wide, but it's a very well-known test. Anyway, I wanted to talk about that one. So let us know down in the comments, do you use this test? Do you like it? Is it a part of your diagnosing, your assessment, or whatever that you do with your patient? Let us know down in the comments. And like Mateo always says, take care of yourself, take care of your patients. We'll see you next time.